better sleep, sharper focus, a healthier life. It all starts with how you breathe.
Welcome to the No One Told Me, the Airway Health Connection, the Untethered Way, where better breathing meets better living. I'm Dr. Meggie Graham.
I'm Dr. Liz Turner.
We're the co-founders of Untethered Airway Health Center,
on a mission to help you breathe freely and live fully through proactive airway health.
Whether you're a dentist expanding your airway expertise
or a family looking to sleep and breathe easier,
you're in the right place.
Each week, we'll bring you bold insights, real-world stories, and expert tips.
All to help you take control of your airway health. Because when you breathe better, you live better. Let's get started.
Good morning, everybody. I am going to talk today about my own personal journey into airway and why I am such a nasal breathing fanatic. Anyone that knows me knows that I'm watching for mouths open, talking about what you can do to breathe easier through your nose, connecting the dots to sleeping easier, because once you see it, you can't unsee it. We say that all the time. And once something is personal, it's next to impossible to not be passionate about it. So why do I care so much? Well, I care because I want my patients healthy, because I want other dentists to have fulfilling careers that make a difference. But really, it started because I am the patient. And I want to walk you through kind of how I landed to find that understanding and how that journey has shaped me as an educator, as a provider, as a human, how I would do it differently if I could with the knowledge that I have now and the clarity of hindsight. I get asked the question, and I don't talk about it a lot, but I am a forever learning nerd. I am a CE, or continuing education junkie. I got out of dental school almost 17 years ago and was fairly unfulfilled pretty quickly. I was high stress, didn't get a lot of reward, felt over my head with the day-to-day of single tooth dentistry, which is not wrong, but it wasn't satisfying what I thought it was going to be. I had this romanticized vision of dentistry and making a real impact. And I felt like a lot of my patients just hated me. I was causing pain. I was telling them that bad news, and, it was expensive. There's a lot of stereotypes around dentistry and dentists. And some of it comes from a place where it's not enjoyable to go to the dentist for many patients. And a lot of that comes from that we're putting out fires. We are trained to be firefighters, to put out fires. And with that, we have to give bad news. Sometimes a patient comes in knowing that they have a problem, an acute problem, an infection or pain. But so frequently, patients come in thinking that everything is right, or they're bracing and they're hoping that everything is okay. And then the dentist is the bad guy or gal who has to tell them that you have a cavity, you have a broken tooth, you have blah, blah, blah. And then we tell them that they should have it fixed, and they don't want to have it fixed. And then there's this discord that continues. And then that is, we talk about it from the patient journey a lot, but from the dentist, that creates a lot of angst and a lot of stress. And it didn't, as a people pleaser at the time, now I like to say I'm a recovering people pleaser, but at the time, I didn't love going into all of my patient exams without answers. I'm a know-it-all, and I didn't know it. And I couldn't bullshit my way through why it was happening, because what I was noticing were the patients that were coming in time and time again with bad news being handed to them, more work to be done, something else failing, were the patients that were like me. They were people pleasers. They were following whatever instructions I gave them, and they were using all the products, and they were coming in on 90-day or 6-month recare cycles, depending on what they needed. And yet they always seemed to have problems. And then there was this other demographic of patients that were using the wrong end of the toothbrush, eating sugary snacks and refined carbohydrates and doing all the things wrong. And yet they would come in and there was never any fire to be put out. And you know who you are, patients and providers. You can recognize these patients in your schedule. You know if you're cheating and you're getting away with it. And you also know if you are the best patient ever and doing all the things, and yet for some reason, you're continually needing to spend time, money, and energy and angst at the dentist putting out fires. And so that just didn't sit well with me. And I didn't have a tool in my know-it-all belt. And so I started learning more and learning more and learning more and signing up for courses and spending tons of time and money trying to figure it out. And that became a drug for me. And I loved the education. I landed at Spear Education. I landed at Coyce Education. I went to all sorts of other education centers, and I just devoured the information. And a lot of my dear friends are way smarter than I am and have the ability to have like this photographic memory. They can hear something once and they can recite and spit back literature and facts after hearing or seeing it once. I need layered learning. I need it told to me again and again and in different ways. I used to go and record the lectures audio, and then I would sit on the airplane with my iPad and listen to the audio recording and rewrite my notes. Like I had a lot of time and I was just obsessed. Then I became a mom and had kids, and I started dragging babies with me. I brought nannies, I brought family members. I couldn't stop learning. And while that was really fun and exciting and, part of my identity at the time, it was started from trying to answer questions. And it was this aha moment for me sitting at Spear, listening to my now friend and mentor, Jeff Rouse, connect some dots that I hadn't previously heard. And it was like eating Pop Rocks, which are really bad for your teeth, but really fun to eat. All of these light bulbs were flashing and going off at once. And he was talking about the connection to sleep-related breathing disorders or dysfunctional breathing, to make it really simple, acid reflux, and bruxism or grinding the teeth. And I had spent a lot of time thinking about how the teeth fit next to each other and how the teeth fit together, teeth to teeth. But I hadn't zoomed out far enough yet to see how did the teeth fit in the bone, and even bigger, how did the bone fit in the face, and where did the face fit into the rest of the body? And his lecture talking about his son Jake and connecting the breathing to the occlusion or the bite was absolutely my tipping point. And I cascaded what was a rabbit hole into a crater of education. And it actually helped me start to answer questions. And I went home and I had more tools in my know-it-all belt to give my patients as ways to reduce risk. And now that was probably 12 years ago. And so that learning was layered and my tools grew. And I have a very different approach to risk management now than I did then, but that was my jumping off point. The other part that was kind of the spark that kept me going was not only did I now have more tools to give my patients and more answers to give my patients about risk management and helping them discover that they were dysfunctional breathing and what are the different things that we could do to help you breathe better, not only to feel better, but to decrease your dental risk. I recognize myself as the patient. I saw myself in every single slide, and I had never known that I had been suffering for decades. Or if I did, I didn't connect the dots because it wasn't major suffering. It was like these micro sufferings. I think back to stories, right? Like I was always called the Venus flytrap because, and we have albums of me with my mouth wide open sleeping. I couldn't breathe through my nose. And so I breathed through my mouth and I would have my mouth gaping open. I had speech issues, not bad enough to be sent to speech therapy. I learned to compensate and figure out how to speak, but I didn't speak clearly. I remember my mom telling me to not swallow my words. I've always been a fast talker. That has nothing to do with muscle dysfunction, I don't think, but I was a garbled talker. And my mom would point it out. Hey, you're swallowing your words. I don't understand. What are you saying? And that was because I had a tongue tie that was undiagnosed and I was using the wrong muscles to speak. I was a fast eater. I would eat really, really quickly and I would eat with my mouth open. And I now understand that that's because I didn't have the muscle function to control the food bolus, to chew, 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 make a nice little compact bolus of food and then swallow it. I had to chew fast and get it down because I used my the same hole that I was using to eat to breathe. And so if I took too long to chew and swallow, I would stop breathing. And I also, by the time I was on this Airway continuing education journey, I had ground my teeth really, really flat. I remember in dental school, my friend Allison, who has just beautiful teeth. And I remember her canines had this beautiful point, not like vampire points, but just this beautiful cusp with what we call incisal embrasures. And I remember asking my dad, can you make my teeth look like Allison's? I want those points. And he told me, you're just going to knock them off. You're going to flatten them out. You need to have flat teeth to live. And he didn't understand the connection to the grinding related to breathing, but he did understand occlusion enough to know that you can't just put points somewhere. I had worn mine flat for a reason. I also remember before my wedding thinking, I wish my smile was bigger and broader. When I smiled, I had these black spaces between my cheeks and my teeth. We call them the buccal corridors. And that's just because my mouth was tiny. But I wanted them bigger. So I had a dentist put veneers on my teeth and bulk them out to try to make my mouth look bigger and broader. And I see that all over Instagram, and I see that all over cosmetic cases where it's a camouflage. It's a mask to try to make a deficient skeletal structure look bigger and better, because we are attracted to, we think that was what we find what is aesthetic to be optimal and healthy. And so we want a big, broad smile because a big, broad smile is representative of health. Even if we don't know that, that's something that's important in how we identify beauty. So I remember those things. I remember that I had a big overbite. And at the time, the orthodontic plan was to help couple my teeth together so that they could match up ideally, not by promoting forward growth of my mandible. Actually, my upper jaw was also back too far, but because there was a discrepancy between the lower jaw and the upper jaw, they actually had me wearing headgear. And because I'm a people pleaser, I wore that headgear that retracted my maxilla, my mid face, like it was my job. I got all the gold stars. I recently found it in my sock drawer at my parents' house. I tracked that. I wore it 16 hours a day. And they were just doing the best they could. They didn't know any better. We know better now. And we know that if the muscles don't function correctly, and they didn't function for me, I couldn't use my tongue correctly, I couldn't speak correctly, I couldn't eat correctly, I didn't grow optimally. And so my skeletal structure was deficient. My face was too narrow. My floor of my nose was narrow. I had a deviated nasal septum. I had a bite that didn't quite fit together. I couldn't sleep. I always had insomnia. I always came downstairs after I went to bed. I couldn't fall asleep. I couldn't stay asleep. I had tons of anxiety around sleep and generalized anxiety in my day to day. All of these things were clicking as I was hearing these lectures and saying, oh my God, I can't breathe. I was sitting in the lectures mouth breathing and didn't even realize that there was a difference between nasal breathing and mouth breathing from the perspective of health. So once I recognized myself as the patient, I wanted to fix myself. And at the time, I didn't have the zoomed out view to have all of the pieces that I do now to be able to see how the structural anatomy, how the muscular function, how it all goes together. And so I piecemealed my way through treatment in a very disorganized fashion. However, I wouldn't take it back because I think it helped me as a provider. It helped me learn a lot. It helped me meet some amazing people. I had my tongue tie released. I had my nasal septum fixed. I had a MARPE done, or a bone-borne expander. I got my local orthodontist to do it for me as patient number one, with no consideration for my lower teeth that were also in an arch that was too narrow. So then I added surgically facilitated orthodontic treatment. I convinced my friend and periodontist to do that on me. We had no plan for what to do with the spaces afterwards, no restorative game plan. It was a mess, but I went through each stage and I learned something along the way. And it has been a powerful journey to not only realize that I had all this micro suffering my whole life with poor sleep, poor breathing, wearing down my teeth, but also then to connect those dots for my patients. It was just profound and really amazing. I wouldn't change it. I'm really happy for the journey because it has me right here where I am right now, passionate about helping patients get the comprehensive care that they deserve and also helping providers connect the dots so that they can identify themselves as the airway patients, because you probably are, but also so that they can offer their patients responsible treatment plans and treatment options so that not only can they be systemically healthier, which is obviously a huge goal, but so that their dentistry can be predictable, so that they don't have to have patients come in every 3 to 6 months doing all the right things and being told that no, they have problems again. And that builds relationships. That is a happier way of being. It's lighter. It's filled with love. I love it. I get to do that. But my journey is augmented by the fact that I'm a mom and I started recognizing these issues in my kids. I missed it with baby number one. She also has a tongue tie. We know that there's a genetic dominant trait. So, of course, if I have a tongue tie and her dad also has a tongue tie, of course she's going to have a tongue tie. But I didn't know that at the time. We had a very tumultuous nursing journey. She self-weaned at 9 months. I had tons of pain. I didn't produce enough milk. And I know now that that's because her latch was dysfunctional. She was using her little bones to squirt milk in rather than using her tongue because she was unable to get the milk out of my breast. And that caused all sorts of reflux for her and poor sleep and all sorts of symptoms that I now recognize as symptoms of ankylosing and poor muscle function. I didn't know it at the time, but that also set her up for not growing optimally. So we jumped in when I learned, I think we had her tongue tie release and did expansion on four at her when she was on her when she was 4 or 5. And then I knew more for my second daughter and intervened differently and earlier for her. And I knew more for my third daughter. So the layered learning is helping me be more preventative and proactive with my own kids. It's helping me feel better and be healthier as a human. And it's helping me be a better provider by connecting dots for my patients. And it's helping me be a better educator by helping connect dots for providers so that they can see just how nuanced this is. This is not something that we're taught in dental school. We are taught to be firefighters. We're taught to put out fires. We're taught to be reactive. And if we're taught to think interdisciplinarily with other specialties, it's not outside of dental specialties. We're taught to work with periodontists. We're taught to work with oral surgeons. We're taught to work with orthodontists. But if you think about the anatomy of the jawbones, the face, it is the middle of the craniofacial respiratory complex. And every time I say that word, I have to give a shout out to my friend and mentor, Kevin Boyd, because it is such a hotspot for so many systems. The middle of the face is the floor of the nose, the roof of the mouth, the front of the pharynx, the airway. And if that grows deficiently, so many systems are compensating, so many systems are compromised, and so many fires need to be put out, not just dental risk and dental fires, but systemic risk and fire. So if we can get to the root cause in infancy and childhood, fantastic. If we can jump in adulthood and change somebody's trajectory and story and decrease their suffering and decrease their risk in adulthood, how powerful is that? How lucky are we that we get to make that sort of change? So that's my why. I can't believe I get to do what I do. I can't believe that you're here listening to this today. It's a privilege and an honor. And I can't wait for the podcasts that I do in 10 years from now, looking back at middle-aged Meg rather than dental school Meg, connecting dots and thinking, gosh, I wish I would have known that. Then the journey would have been different, because I commit to continuing to always learning and always doing better, not only for myself, but for my patients and the people that I have the privilege of speaking to and teaching. So thanks for being here today. Please share this. Liz and I are evangelistic when it comes to spreading airway awareness and understanding that there is a right and a wrong way to do things when it comes to being comprehensively minded and helping your patients be as healthy as they can be. So share it. If you are a provider, come learn with us. Go to theuntetheredway.com. If you're a patient, follow us on social media. Go to our website, go to Untethered Airway Health Center. All these links are below. And we'll see you next time on No One Told Me, the Airway podcast.
Thanks for tuning in to the Untethered Airway podcast.
If today's episode helped you see things differently,
Please share it with someone who would benefit from hearing this. And don't forget to subscribe.
want to learn more about airway health or connect with our team?
Please visit our website, untetherediirwayhealthcenter.com, or follow us on Instagram @untetheredairway.
Until next time, bye.